our patient right over here. I have already drawn his blood. I'll just show you in the centrifuge. I've already drawn his blood. The blood that I've drawn, it's the red blood cells, well, all the blood. And now we're going to put it in the centrifuge and it will separate the red blood cells from the platelets. I've applied a lidocaine cream on the patient's penis and surrounding areas to make the first injections a lot more comfortable for him. Here's all the equipment they'll be using, and I will be opening everything up in front of the patient to assure that everything is one-time use for them. The PRP has spun in the centrifuge, and I'm going to prepare all the syringes with our liquid gold. Here we have the red blood cells, the agent that keeps it separated, and the PRP, the platelet-rich plasma. The PRP is now ready to go. I've leveled it out. We have a nice amount of PRP. Here we have the xylocaine, which will be the first injection the patient gets, is an anesthetic. And then we have some calcium chloride, which activates the PRP, so it is easily injected into the penis and it goes where it needs to.
Okay, so the next step of the procedure, we're going to inject the PRP. We inject in 4 different places in the penis, and then the 5th place on the head of the penis, because that's a different area, a different system. We call that the spongiosum tissue, so we want to get it spread out to all the areas of the penis. Normally apply a little bit of pressure just to prevent some of the bleeding, the bruising. How do you feel? Easy as that.
A weird sensation.
A weird sensation.
The numbness.
Yeah. You feel like you can't feel parts
right.
of the penis? Okay. So the next step, you know what that is?
The pump, right?
Pump.
Yeah.
All right. So let's get to the pump.
Okay, here we have, this is the last part of the procedure, the penis pump. It's important to use it immediately afterwards to promote blood flow and circulation. And I'll just explain to the patient how to use it. Give you a tube of lubrication, goes inside here, and along the base, and then along the glands of the penis. It's important to be shaven because it creates a better suction.
Yeah, I like using the pump for 2 reasons. One, it stimulates the blood flow right away to the penis. And when you get an erection, the actual blood stays in the penis more. So the PRP will stay there as opposed to being flushed out. The other thing is that the increased pressure, I think, prevents some of the bruising, bleeding from the sites as well. So it's like putting on compression on the penis. So we've adopted that. And many of the many of the main sites use this technique as well.
I'll just mention something about this pump that we use here. It has a gauge on it, which makes it different than the pumps you buy online or, at a shop. It's not really to promote a large erection or anything like that, like some of the other pumps. It's really for the blood flow and the circulation. It's important to keep an eye on the gauge. Why it's important about this pump, you're going to be taking it home with you, and you have to pump 10 minutes twice a day, 20 minutes total every day for 30 days.